anyway, three cases pretty much at the same time. They all pretty much said the same thing. And what's interesting about the cases is they were the beginnings not just of informed consent, but of sort of laying out what constitutes medical expertise and what constitutes patient expertise. So the interesting part of Cobbs v. Grant and Canterbury and whatever the third case is, isn't the fact that they decided that people had a right to give their informed consent prior to being operated on. What was interesting is why they came to those conclusions at that moment. So it's not as if people weren't being operated on prior until 1973. And what the courts talk about are a few things. One is that the nature of medicine changed, that you could do all this stuff to people. So Warren Berger, in one of his typical uninformed moments, commented on how ironic it was that the more doctors could do, the more they get sued. And he didn't consider the fact that the more doctors can do, the more harm they can do. So that, there's no anesthesia malpractice until there's anesthesia. That the thought that that's ironic is just a sign of not being very thoughtful about these things. And it's true. So that, the more poisons one gets, so, chemotherapy is a poison. It's a useful poison, but it doesn't make it not a poison. Surgery and cut people's hearts, it's a risk. So, so it used to be that medicine couldn't do very much, so there wasn't much to really consent to. It was not until after World War II that doctors could really fool with people, up to that time. And it was pretty clear what the risks were. So one of the early cases, I think it actually is the Stanford case, is about a woman being treated for breast cancer, interestingly enough, who was burned from cobalt therapy. She was surprised, right? She thought she was going to be treated, and she woke up and her, bones and musculature and all that were like burned away. And, what the court noted is that no amateurs know what those risks are. The doctors do. So we know what the risk is when someone cuts their leg off. It hurts and you're not going to have a leg. But when someone does cobalt radiation therapy, unless someone tells you what the risks are, you have no idea what they are. And so that was the start of it, is that medicine changed, that the risks became much less visible and much less known. And medicine could also be harmful as well as useful, and that the question is who should weigh those risks. So the early cases pointed out that doctors are experts in what the risks are and in balancing those risks, but that they're not expert in determining what risk the individual is willing to take, and how the individual assesses those risks. That is a non-expert skill that only the patient has. So it is a nice description of the doctor-patient relationship, that the doctor isn't supposed to, that physicians have to decide for themselves that a treatment is worth doing. But that's their job, is to do that. That doesn't mean it gets done. And the courts say once the doctor decides that for themselves, then they need to let the patient in on the secret about what that means and what the risks are. And so it just sort of makes perfect sense. It comes at a time of consumer empowerment, too. It's not just the women's movement, the civil rights movement, but this notion of, informing people about loans, what an APR is, that, the notion that there were consumer rights are all part of what's going on in society at the time, that people should not be acted on, but that people should act for themselves as long as they have sufficient information. It's all part of a changing social scheme.